picking up with Chapter 2 from your Fundamentals book, and it's about evidence-based practice and research in nursing. So in Chapter 1, we talked about the history of nursing, and just remembering that Florence Nightingale is the first nurse that's been credited to talking about or documenting research, and that's because she did the statistical study of sanitation, and that was during the Crimean War. And then in the 1900s, the 1940s, there was focus on developing nursing schools. 1950s to 1970s, there was a focus on types of curriculum and issues with teaching, and just about making sure that nurses were getting the proper education across the board. In 1980s, there was computers, which helped with data collection, so there's a lot more research that was happening and a focus on qualified researchers. And in the 1990s, there was a focus on cost that patients would have to pay, access to care, quality, healthcare determinants. And then in the 2000s, in the 21st century, the time that we're in right now, there's a big push for evidence-based practice. And it's really important that nurses know how to use evidence-based practice, how to look for it. Even if you're not part of the research process, we still need to be able to systematically go through evidence-based practice or look through research to determine the best ways that we can improve patient care. So there's the learning outcomes here. Being sure to be able to explain the relationship between research and evidence-based practice, differentiate quantitative versus qualitative approaches, and then describe different roles in nursing related to research. Now, in Chapter 1, we kind of talked about that. So the doctoral prepared nurses will often be ones conducting research, but your bachelor's prepared and master's prepared, they might be assisting with research, but bachelor's prepared are definitely analyzing the research and using it, even if they're not actively doing it. So, kind of just hit on a little bit of a history, which I'm not going to test you on the history for all those specifics. I just wanted to kind of give you an idea of where the focus of nursing has gone. As mentioned earlier, that patients and healthcare employees really want to have standards of practice that includes evidence-based practice. If you were sick and you were visiting a hospital in Texas, you would hope that they're using the best practice in Texas as they are in South Carolina or Illinois or Alabama or the state of Washington. So that's why it's very important that best practices are published, and we'll talk more about that later. Nurses are expected to engage in research activities and share their knowledge with other nurses. So even if you do something small on your unit as a quality improvement, it's important. Maybe it doesn't get published in a journal, but it should get published within your organization or affiliates, just to help other units and other hospitals potentially improve. And we know that evidence-based practice and looking at that and integrating it into the way we care for our clients helps not only our clients, but it helps the nurses know that the policies and procedures that they're following is best, and that they have a knowledge base, not just, oh, this is the way we've always done it and it works. So we do it because it works, and why does it work? So what is evidence-based practice? So your book describes it as integrating best current evidence with clinical expertise and patient family preferences to deliver optimal health care. So the thing about evidence-based practice is, if you're going to be looking at that from the healthcare standpoint, you want to have what your book describes as a spirit of inquiry. And the spirit of inquiry is just like asking questions. I'm going to talk about the 6 parts of what makes a good researcher later on a different slide, but it truly is something that I hope that as you are a student at Methodist College, you're going to start developing a spirit of inquiry. You're going to ask questions. While you are a student, you're actually going to be using evidence-based research and actually come up with a project that you will do around your junior, senior year to make an improvement on a particular unit that you're on. So how are you going to do that? You're not going to go conduct research, but you're going to search research and critique it and find out, ask a question of how you could improve something, and then go through and evaluate all your research, and then eventually implement and evaluate it. Bolded here on this slide is evidence-based practice helps improve work environment, clinical practice, and patient outcomes. That's why nurses need to be aware of what it is and how it's collected, and how to just because it's in an article or something online doesn't necessarily make it evidence-based practice. So during your time as a student, you're going to learn how to evaluate these types of research studies. So what is research? Well, sometimes it's done a couple different ways. We're going to talk about qualitative and quantitative, but research typically is formal and systematic, and it's there to address problems and help answer questions. It should be accurate. If it's done well, it should be accurate, dependable, and free of bias. So you want to make sure that if you're looking at a research article that's done by a drug company, you want to make sure that, well, I kind of would just be questioning if this would be done with a drug company, especially if it's pushing or promoting their drugs. So there's potential bias. So you want to be sure that you're looking at who is doing the research, what is their qualifications, how was it collected, how many people or topics were looked at. So nurses are going to use these findings to help guide decisions about the client care, and that can be from newborns all the way to elderly, just the way that we can care for people and their families. So on page 27, it talks about 3 components that's used to come up with evidence-based practice, and that's to help improve outcomes and the quality of life. And so there's the clinical expertise, which could be what's happening in the healthcare units, what's happening in the clinical setting. Best evidence, that would be examples might be some scientific research that's been done that's promoting a better way of doing something. And then we're looking at the patient values and their preferences. So there's 3 components that make up evidence-based practice, and that's also in your book on page 27. The 6 steps of evidence-based practice I started to talk to a little bit too early a few slides back, but I'm going to go through these. So first, it's cultivate a spirit of inquiry, and that just means ask questions. You want to know more. Don't just settle for, oh, this is the way we've always done it and this works for us. Always see if there's something better out there. You want to ask clinical questions. How could this improve something? And why is it that we do what we do? Search for the best evidence. And again, that's going to be reviewing articles, reviewing the actual studies to see if it is the best evidence or not. And that's also called critically appraising the evidence. Then you can integrate this evidence with the clinical expertise and also look at the client and family preferences, kind of those 3 components of evidence-based practice. Then the final one is actually implementing and evaluating outcomes of the interventions. There are some negatives regarding research, and sometimes research just isn't really matched up to real-world healthcare delivery. So research often is in a perfectly controlled circumstance, and we know that any day in a healthcare organization, or honestly any day in your life, isn't going to be a controlled circumstances. So there's a variety of things that could happen. So it may not, the results that happen in the study may not be the same types of results that we will see in the real world. Your book also refers to research as being a one-size-fits-all solution because there's no way that they could really encompass the variety and diversity that comes to healthcare. So it may not work for every patient or every situation. It may also ignore significance of life events to an individual because there's emotion that comes into the patient's experience. All of these things depends on how the research was done. It's not, the best practice isn't always going to fit for everybody. And kind of throughout all this, I've been hitting to the point that not all research is flawless. There are flaws to research. And we like to say that research would be done to promote cost-effective, better care, but sometimes when the research is done, the cost is not always included in the research notes. So as far as looking at nursing research, we want to be sure that you, as a bachelor's prepared student, when you graduate, you are going to know how to conduct or how to evaluate articles and research studies to be competent and also to be able to use that in the way that you guide your care. So what is expected of a BSN and higher levels of education is that you can actually look at research and actually not just understand it, you're going to generate new knowledge and be able to implement it. That means actually use it to promote better practices. So there's a couple different types of research approaches. The first one I'm going to talk about is quantitative. And quantitative, you see all these numbers here. I like to think it is more of like a numbers thing. So it's statistical analysis, you have interpretation of numerical data, there's more statistics and very measurable. So they may be doing something called a meta-analysis, there might be experiments, there might be case studies. And how does quantitative research, what exactly does it answer? It is helpful in answering what causes whatever the particular problem is. It's useful in arriving to find out what treatment is more effective, what factors are associated with a condition, and who, what, when, where, and how something is done. Qualitative is different because instead of numbers, it's more words, it's more of experiences. It has to do with why do people take risks possibly? How are they handling grief? What makes somebody have hope? So it's really looking at that human experience, sometimes a cultural pattern or a social process, and there are terms that go with those. Ethnography is looking at like a cultural perspective about an issue, and again, that's qualitative. You can't put numbers on that. That has to be the human lived experience. Social processes, the word for that is called phenomenology. So again, it just has to do with helpful in understanding what the patient says it is. So qualitative answers something along the line with what is the experience of having that diagnosis or going through the treatment? What are the behaviors of this certain types of group? There might be a particular diagnosis or something that's being looked at, and then they break it down. And what is the particular diagnosis or the experience of a particular diagnosis, I should say, that a particular ethnic or cultural group is having? And how does this particular group cope with whatever the diagnosis or problem is? So this is just kind of a comparison of quantitative versus qualitative, and I always just remember quantitative sounds kind of like the word quantity. So I think of numbers. And qualitative, if you were going to describe a quality experience or a lack of quality experience, you would use your words. So I always think of it along the lines of numbers versus words, which some people refer to that hard versus soft data. Um, Quantitative, you're kind of like an outsider analyzing and looking at things, and qualitative, you're kind of getting an insider's perspective of what's going on with it. So kind of one is more facts and the other one is more meaning and understanding. So overview of the research process. Regardless if it's quantitative or qualitative, the same general steps are involved with the research process, and we will go through those. But first is going to include narrowing down whatever the problem is or the purpose is. So you could have a large thing and you need to kind of, the first thing is to kind of narrow it down into a specific problem that's significant to nursing. And we'll move on to one strategy that's helpful with this, and that is called the PICO format. Let me get that up here. So this is a way that we can look at the patient in terms of their health status, etc., and find the population of interest and what is the intervention that we would like to use, whether that would be a test, medication, a therapy, something of that nature. C is comparison of interventions, and O is the outcome, and T is the time frame. Now, that's called the PICO format, and as a senior in our program, you, as I mentioned earlier, are actually going to develop a PICO project, and I'm going to try to find one of these and bring that to class so I can show you one that students have done on a poster. I used to have several in my office and I kind of cleaned things out, so I'm going to look around and see if I can find one from one of the other instructors. So I'm going to show you on this an overview of how this is used. So the example number one, it says in adult patients with total hip replacements, so that would be your P. How effective is pain medication? So your P is your population or problem of interest, which in this situation it's adults with total hip replacements. I is your intervention, and that would be your pain medication. How effective is pain medication? Compared to aerobic stretching, so the comparison of interventions is comparing aerobic stretching, so it'd be exercise, in controlling post-operative pain. So they didn't give a time frame here. So this next one, I'm going to have you help me break it down. So it says in preterm neonates in health facilities, is skin-to-skin contact immediately after birth more effective than conventional care in preventing hypothermia? So when I look at this, what do you think the P is? So what is your population or problem of interest? So preterm neonates. And then the intervention is skin-to-skin contact immediately after birth more effective than conventional care in preventing hypothermia. So your intervention would be skin-to-skin contact. C is your comparison of interventions. So comparison would be your conventional care. Your outcome would be preventing hypothermia. And I went ahead and put a T for a time frame because the time frame would be immediately after birth. So it's not looking at preterm neonates 2 months from now. It's looking at preterm neonates immediately after they're born. So I hope that helps you there. This next is a chart that kind of just talks about how is evidence-based practice evaluated. So The first thing is you gotta, like I mentioned earlier, narrow it down, and that PICO format kind of helps with that. So formulate research problems. So at this point, you're narrowing a broad area into a more specific problem. Next, you're determining study methods. So you're looking at how was it organized, what sources were used, what's the design of the study, what methods were used. Then you're going to collect research data. Now, you yourself, again, might not be collecting the data, but you're going to look at the protocols that were used and make sure that there was consistency. Analyzing research data, again, it's kind of goes with how was it collected, but you're looking at it to see, is it reliable? Is it valid? Look at the statistics. Communicate research findings. So this means you're going to look at how was it communicated, and if you were actually an advanced practitioner, you might be publicizing your findings or putting it in a newsletter. So even if it's like on your unit, you guys do something on your unit, communicate your outcomes, and that could just be your nurse manager, maybe sharing that with the hospital. Or maybe you would be putting together a poster, and that's something that you will be doing as a senior in our program. And then you're going to use research findings in practice. So based on all these things that you did and looked at, it's going to help guide practice. Many units do something called a pilot study, so they're not ready to change all the policies in the hospital, but they're trying something out to see how did it compare and what was the cost-benefit analysis. So here, this is just kind of an overview of what our job is as a nurse, responsibility for research. We are research consumers. Should be able to, we're considered a research consumer, and we're a research team member. And again, maybe you're not conducting the research, but you need to be able to locate literature, be able to critique it, and be able to bring that forward. So it's very important that you know where to find it, and what are good sources to do that. So this next video on YouTube, it takes 4 minutes to view, and it shows you how to locate research.
In a Steely Library database such as CINAHL, at this point in your nursing career, you've likely heard of evidence-based practice. It involves integrating your knowledge in the patient's condition with the existing research to make decisions. If Andrew told his patient he was going to use a new technique to provide an injection, and not to worry, he saw it done on YouTube, the patient might not react well. However, while showing a demonstration on YouTube might be useful, Andrew might also want to cite some examples of the technique used with other patients and the successes or possible risks associated within those examples. In this way, Andrew is bringing in outside information as evidence to aid in decision-making. But what type of evidence is best? Is every published item considered evidence? These are questions we will explore in this video. But in the meantime, let's start with this pyramid. This image is often used to demonstrate the various research designs behind published research, and the types of sources you will encounter as you search for information. The pyramid shape is used because as you move up toward the top, the research becomes higher in quality, but the quantity of the research becomes smaller. For example, a systematic review at the top of the pyramid is when an author seeks all the research on one topic and combines it into a single analysis. This is the highest level of evidence, but they are also time-intensive and rigorous to complete. Therefore, you will find less of them when searching. Ideally, you want to find research that fits into categories at the top, but depending on your topic, the only research available may be case studies, or in some cases, available information may not even be professionally published. Let's start by talking about scholarly, or also called academic journals. These journals contain peer-reviewed articles, which means healthcare experts carefully read and critiqued the research prior to publication. Andrew often relies on research articles from scholarly journals as evidence to guide his clinical work. Not every scholarly article will look exactly the same, but there are some indicators you should be aware of. For example, the authors of research articles should have the appropriate credentials, such as a PhD or an MSN, and often are affiliated with universities or hospitals. The layout of the articles will usually contain headings, breaking up explanations of the research design, results, background information, and a discussion of what the results mean for practice. Now, as we reflect back on our pyramid, as you look at various types of scholarly publications within these top-tier levels, you will notice some differences in the research. For example, a systematic review at the very top are often so lengthy they will contain a table of contents. And in the methods section, the authors will explain how they chose articles for inclusion in the analysis. Andrew relies a lot on the methods section for any research article, because no matter what type of study, the author should always present their methods to the reader, whether it's a systematic review, a case study, a survey, interviews, or another approach. In a Steely Library database such as CINAHL, indicators are also available to help you determine what type of research is being presented. Look for this in the brief description below each record, where it may say clinical trial, case study, or systematic review. In addition, some resources will be more useful than others for certain types of research. For example, the Cochrane Library, available through Steely, is well known for its large collection of systematic reviews and controlled trials. Of course, not every piece of information will fit neatly into this pyramid shape. Sometimes articles might appear to be professional, but aren't presenting any research at all, or perhaps they're summarizing someone else's research. When possible, it's always best to find the original research study, rather than relying on someone else to summarize. At this point, Andrew hopes you are better able to recognize quality information appropriate for evidence-based research and practice. Of course, not every published item will be considered quality evidence, but as you become a more experienced searcher, being able to recognize when research is being presented and the different types of research studies conducted will help you make informed decisions about information quality.
Created using Powtoon.
Okay. All right, so hopefully that video gave some explanation that was helpful to you. But we have some excellent things that are available through the college, and that is the nursing electronic databases. And one of the most common ones is CINAHL, that stands for Cumulative Institute of Nursing and Allied Health Literature. So CINAHL is a sure lot easier to say, but it is very comprehensive. It is very relevant and a great place to go to look for literature review and databases. There's other things here that are listed: Medline, PubMed, and health sources. And page 32 in your book, there is definitely a larger list of electronic databases. But I want you to be able to access this through the college. We have a fabulous librarian, and I'm going to click a link that will let her give you a little intro to what she has to offer you.
Welcome. Today I will be discussing 5 things to know about the Methodist College Library. Number 1, know your librarian. That's me. I'm Michelle Nielsen-Ott, and I'm your expert in all things libraries. I have a master's degree in library and information science, which means I went to school for a pretty long time to help you do better at school. So you can think of me as your new BFF, and because I am here to help. Number 2, find resources. Not just any resources, but the right resources. Your professor will not be impressed with you using Wikipedia and other unreliable sources. The library gives you access to the biggest names in research. Number 3, online content. In the information age, most of the library's resources are online. With the library, you have access to hundreds of thousands of e-journal articles and dozens of e-books, including important works like the Code of Ethics for Nurses. Number 4, off-campus access. Since the majority of the library's resources are online, you can do library research anywhere you have an internet connection. You will need to log in to use the library databases from off-campus to prove that you are a current student. Number 5, use interlibrary loan. The library is connected to thousands of other libraries, and we all share our resources. Contact me to get books and journal articles that are not available at Methodist College. If you have any questions, see us in the library, visit the website, or send me an email.
Okay. So the next place I want you to be able to access is through D2L, and that is the Methodist College Library that you should have access to. And on here, just like the librarian said, there's the library hours. I can't really get all this in my frame very easily, but there are many things. There's even, because of COVID, there's some virtual library hours as well. So there's quick links that you can get to as well. All right, so what is the Institutional Review Board? So what the Institutional Review Board is it is part of the Department of Public Health and Human Services, and its job is to review and approve research because most research involves human subjects, and there have been some really awful things in history that research was not done ethically, and you can read about some of those on page 33 in your book. If you haven't heard about some of them seem long ago, and some of them weren't all that long ago. So one of the ways to help make sure that it's ethical and valid is, before research can ever be even done, it has to be approved by the Institutional Review Board. And that way it's to promote safety and well-being of all the human participants. And they check into it to make sure that it's going to be scientific, ethical, and valid. And this helps decrease the concerns of the public about that. So there are also in your book in chapter 2 rights that the patient has, and the Institutional Review Board makes sure that all research knows that the patients know that they have the right not to be harmed. They have the right for full disclosure, so they give informed consent. So there might be something that there might be a risk involved, and so participants need to be informed of the risks associated with participating. And they have the right to self-determination, so they can determine if they want to stop it, to start it. They have the right to privacy and confidentiality. That means that they should expect it, and whatever the results are, they're still going to be, they might be described like with a certain defining facts, but their name is not going to be disclosed. And what is our role related to research? Well, patient advocate, that is a really big role that we have. And as mentioned earlier, sometimes nurses actually fail in this. And I'd like to say that nurses don't, and that we do stand up for our patients. But we need to be sure, whatever is happening, that we're protecting the rights of the patient or the participant in this. So on page 33, I'm just going to read you some of the things that have happened in case you didn't take time to take a look at this. But as mentioned, that it is the responsibility of all of us as nurses that we are advocates to protect the rights of our clients who are involved in a research study. Unfortunately, there are many historical instances of our failure to advocate for ethical treatment of clients in the conduct of research. Examples of these include the 40-year-long study of black men in Alabama in the mid-1900s who were allowed to go untreated for syphilis in order to investigate the progression of the disease. This is commonly referred to as the Tuskegee study. So hopefully you guys have learned about that in history in high school. If you haven't, man, that is something that we need to learn about our history so we don't repeat it. We can't remove it, but we sure don't want to repeat it. Another one that is mentioned in your book on page 33 is in 1992, the Kennedy Krieger Institute study where they had young children who were knowingly exposed to lead in their homes. And if I know you haven't had pediatrics yet, but maybe some of you are parents and you know that your children gets tested for lead because lead has high doses of lead has irreversible damage that can happen to children's brains. And you know that they're developing their language skills, their motor skills, and with high lead levels, there could be some bad effects. And then that's not that long ago, 1992. So they knew that these children had exposed lead in their homes, yet they were conducting the study. Another example is the Havasupai Arizona Indian tribe. They had blood drawn, and it was studying diabetes and used for additional research regarding genetic tendencies, and they didn't have permission. Some of you may have read The Immortal Life of Henrietta Lacks. I used that before in my transcultural nursing course in the summer. It's a very good book, but it's similar to that where they used her cells to do lots of studies, and never was she did not give consent to that, and neither did her family. Even after she was dead, they continued. There are still Henrietta Lacks cells out there that are being used for studies. So very interesting. It's a good read. I know you don't have probably a lot of extra time, but if you do, it's a good one. So anyway, those were all just really examples that are in your book, but you could probably come up with some more if you did some research where nurses failed to be patient advocates. And that's the end of chapter 2.